Hi everybody, welcome to the Health How-To channel where we talk about some great life hacks and easy tips to achieve better health. In this video, we're talking about how to heal faster after surgery. First, we'll talk about the 4 steps to healing, and then we'll dive into some health tips for each step. Please subscribe and share your best tips that you have found to be super helpful for healing after your surgery or taking care of scar tissue in the comments section below. Pressing the like button will also help get this information to others. If you have someone in your life who you want to help, please share this video with them too. Also, remember that this video is purely for informational purposes and does not in any way replace any advice given by your own healthcare providers. If the exercises or information suggested aggravate your condition, please stop and ask your healthcare provider for further direction. Now let's first talk about what the 4 steps are to healing quickly. Step 1, control the inflammation and prevent infection. Step 2, give your body the proper time it needs to heal. Step 3, give your body the building blocks for growth and proper nutrition. And step 4, increase blood flow to the area so that the wound receives good nutrients and oxygen and has inflammatory debris removal. Now let's get into some detail for each step. Step 1, control inflammation and prevent infection of your wound or surgical scar. The 4 main signs of inflammation and infection include redness, pain, swelling, and increased temperature. For larger or deeper incisions, wounds can take 6 to 8 weeks to heal. If you have any other pre-existing health conditions, wound healing could take even longer. This is where you need to follow your doctor's instructions very carefully. Know if you need to put on a certain ointment and when and how to change your dressing. You may need to avoid baths, swimming pools, and hot tubs. Don't scrub the incision or use harsh soaps. Try to get instructions written down because your mind might be a little muddled after surgery. If you are unsure or have questions, make sure you ask. Keep an eye on the wound to make sure it's not getting infected. Signs of an infected wound include increasing redness, plus pus that is oozing, smelly, or getting greener or yellow, or the incision is opening. Contact your doctor or go to the hospital if you are feeling unwell, like having a fever, chills, chest pain, or difficulty breathing or going to the washroom to make sure that you are not experiencing a serious infection. If you get the okay from your doctor, try putting on raw Manuka honey directly to burns, ulcers, and minor wounds. Manuka honey has antibacterial properties, is acidic, which slows bacterial growth, keeps the wound moist, and helps to debride the wound. You can apply it on the wound or on the sterile gauze dressing. Step 2, get proper rest. After surgery, it's important to take a break from any strenuous activity. Depending on your doctor's instructions, this could mean not lifting heavy groceries, doing yard work, or heavier housework like scrubbing bathtubs, mopping, or laundry. Hopefully, you have people that you can ask for help or have the means to pay for a little hired help. Fortunately, since the pandemic, delivery services for food, groceries, and necessities have never been so convenient. Sleep is more important than ever when you are recovering from a surgery. When you are sleeping, the body switches from supporting your daytime activities and begins to work hard on repairing and growing muscle, connective tissue, bone, and internal organs. Also, a consistent restorative sleep pattern will help your mood, energy levels, and pain tolerance. Check out my video on how to sleep for some more health tips. Step 3, feed your body healing food. To promote optimal healing, try and ensure that your diet has adequate vitamin C, zinc, and protein. Vitamin C can promote your immune system and helps with the synthesis of collagen for wound healing. Contrary to popular belief, oranges aren't the best food for getting your vitamin C. Here are 5 fruits that have a lot more vitamin C than oranges: guava fruit, yellow peppers, which are technically a fruit, kiwi fruit, strawberries, and lychee fruit. Not a big fan of fruit? Broccoli, Brussels sprouts, and kale are also fantastic sources of vitamin C. Zinc is necessary for all the stages of wound healing. Foods high in zinc include red meat, shellfish, beans, nuts, and seeds like cashews and pumpkin seeds, dairy, and eggs. Nuts and seeds also contain vitamin E, which helps to fight against infection and disease. Try wild salmon for its omega-3 and anti-inflammatory properties. Eat protein to help promote muscle growth. If you find that you still can't quite stomach eating meat or you're vegetarian, try eggs in all its various formats. Eggs are a great source of vitamin A, B12, and zinc. You might find them easier to digest if your appetite hasn't fully recovered. During surgery, you may have lost blood. Healthy red blood cells help to bring oxygen to your tissues. What is the best way to support healthy red blood cells? Eat iron-rich foods like chicken, red meat, pork, organ meat, beans, peas, lentils, prunes, and dark leafy green vegetables like kale. Eat fiber so that you don't get constipated. Constipation can be a side effect of anesthesia, some pain medication, and especially since you're probably not as active during your recovery phase. Now is not the time to restrict yourself from eating healthy complex carbs like sweet potatoes, unsweetened yogurt, beets, oats, quinoa, and bananas. Healthy complex carbs, unlike simple processed carbs like sugar, bread, and pasta, are key to giving you energy while you are recovering. Manage your diabetes. High blood sugar can impair wound healing, so it's important to follow whichever diet that suits your specific condition. In general, eat lots of different fruits and vegetables, complex carbs, healthy fats, and protein. Keep your meals evenly spaced out and have a fairly even amount of carbs with each meal so that you avoid those high and low blood sugar fluctuations. Check out my videos on how to quit eating sugar for some extra healthy eating tips. Drink plenty of water to stay hydrated. Your urine should be clear and light yellow. Cut down on salt to avoid retaining more water and swelling. Step 4. Rev up your blood flow. Imagine that your surgical site is a room with one revolving door that represents your blood flow. The nutrients want to come in, and the dead cells and waste products need to be carried out. The slower the door revolves, the slower the good nutrients come in and the slower the toxic waste goes out. But the faster the door revolves, then the faster your injury can get what it needs to recover. And how do we improve blood flow? With appropriate amounts of movement and exercise. After you've gotten the appropriate rest that your surgeon has recommended, it's time to move. But you really have to stick to the recommendations that you've been given, such as not lifting over 10 pounds or bending if that's what's been advised. Exercise according to your health care provider's instructions. If physical therapy rehabilitation has been prescribed, you should do it. The physical therapist can help you to meet your recovery milestones so you recuperate as fast as possible and avoid any complications or body compensations like limping. Try your very best to stick to the home exercise program given. Don't stay in bed for too long. You'll risk bed sores, muscle wasting, blood clots, decongestioned heart and lungs, or pneumonia. After a long stay at the hospital or in bed, you may notice that simple activities like getting dressed or using the stairs can leave you tired and out of breath. Walk around to stimulate your bowels so that you don't get constipated. Go outside for fresh air and natural vitamin D from the sun, which is important to support bone growth and wound healing. Try to get your vitamin D exposure when the UV rays are at their lowest before 10 a.m. and after 4 p.m. And don't feel that you need to get a tan to get the benefits of vitamin D. Your body makes your daily vitamin D requirement long before. For people with light-colored skin, it could be a mere 15 minutes in the sun with the arms and legs exposed. And for darker skin, you can enjoy the sun for 2 hours. A great reason for going outside to get your full daily vitamin D requirement naturally is that You won't get vitamin toxicity from taking too many supplements. And best of all, it's free. Be sure to cover the new scar tissue from the sun because it doesn't have any pigment and it can get sunburned easily. If you've had anesthesia during your operation or you've been in bed for weeks, make sure you do deep breathing and coughing exercises to keep your lungs clear of thick and sticky mucus. Mucus, also known as phlegm, traps dust, allergens, and bacteria. When too much mucus stays in the lungs, breathing and coughing can get harder, leading to an infection of the lungs known as pneumonia. Pneumonia can be life-threatening, so if you have a fever, chills, trouble breathing, nausea, or vomiting, mucus that is green, yellow, or red, sharp chest pain when breathing, or feeling confused, make sure you seek immediate medical attention. If your surgery was over the chest or stomach and you need to cough or sneeze, keep a small pillow close by and hug it gently to do a controlled cough. Later on, when the stitches and healing are further along, you can just put one hand over the other to act as a pillow. Remember, coughing is good after surgery because it helps to keep the lungs clear and lessen the chance of pneumonia. And here's one last tip to heal faster after surgery. Stop smoking. Yet another reason to quit smoking or vaping is that it slows down the rate of healing because nicotine narrows your blood vessels and slows down the transportation of good nutrients and oxygen to your bones, muscles, organs, and tissues, and suppresses your immune system. Nicotine also increases blood pressure, which is why smoking can raise your risk of heart attacks. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Also, please press that like button because it can really help get this information to those that need it. Thanks for watching, and I'll see you in the next video.